We're going from 12 inpatient ORs to 15. Plus we're creating 2 new cath labs and an electrophysiology lab for cardiology. Relocating all of our cardiology into one space, where today it's in 2 different spaces.
With technology, we're actually able, if you look up here, there's plates, heavy-duty plates that will hang equipment.
Well, this is about a $90 million expansion and renovation. We're adding about 150,000 square feet of renovated and new construction. So it's a significant investment and a significant in scale.
We use the electrophysiology lab to put in catheters up into their heart and then find that.
So today the ORs are about 420 square feet, and the new ORs are on average going to be 650 square feet. This allows us to create less clutter in the room, which allows for an even larger sterile field for the surgeons and the support staff to work around the patient.
Eventually, it's very important that that is in there and done the way it is so that we can...
Yes, we're putting infrastructure in the ceilings that allows support for multiple heavy equipment for today's technology, but technology in the future.
So this is why we're so excited about our hybrid suite and the fact that we'll be able to treat more patients with newer technologies with less invasive forms.
We are the region's leader in surgery. I think the latest statistics I saw, we had about 28,000 surgeries. We've had to keep working, and we've been very busy this year, as everyone knows. So we've had to do off-hours work, weekend work. Logistically, it's been a very challenging project. There's very many details that had to be worked out, and the physicians gave input on every part of this project, from the size of the space to the flow between rooms, even to where the doctor's lounge and consultation rooms would be.